Joining us now, we have Dr. Gill. He is the president of the board of directors for the American Heart Association here in Indiana. Dr. Gill, hi.
Hi, how are you doing, Mary? Thanks for having me.
You're so welcome. Great to see you again.
Yes.
We are expecting snow this weekend. So snow means perhaps some shoveling.
Yes.
There are dangers to shoveling that we want to be aware of. So some tips from the American Heart Association. We talk about give yourself a break
For
between
sure.
shoveling.
One of the things that I talk to my patients about, so I'm going to start with speaking to the person who might have cardiovascular disease or hypertension or be at significant risk for cardiovascular disease. Think folks that are a little bit older, have other cardiovascular risk factors like smoking, high blood pressure, diabetes. For these folks, many of us are not as active as we ought to be during the winter months. And then all of a sudden we get a big snowfall, we've got to clear the driveway, and we're going to go out and do very vigorous exercise, but we're actually going to do it now in a freezer because it's freezing outside when we're exercising, clearing the snow. This poses a particular risk to all of us. Our skin vasoconstricts, our blood pressure rises when we exercise, and it rises even more trying to keep us warm internally as we are doing this sort of vigorous activity. For those who are most prone or at risk for having heart attacks or arrhythmias or flares of their congestive heart failure, perhaps, these are people that, frankly, I tell many of my patients, it's worth 15 or 20 bucks to the kid in the neighborhood to shovel their drive for them. And for others of us that are going to go ahead and do it as well, I tell them to really do less than they think that they can do and take breaks. They don't always, I know I don't always appreciate how hard I'm working as I'm trying to furiously clear the driveway, in order to get out and things like this. And before we know it, we can really work up a sweat in our clothes. We are gassed and we're breathing hard and heavy. And for some of our patients, I think that they're developing chest tightness and shortness of breath. And if you get to that point, you've got to stop and rest.
Especially you speak about blood pressure and having someone having a heart condition and they hold their breath when they pick up that snow that's too heavy. I mean, that could be potentially fatal. I mean, we've seen heart attacks in people during snowstorms across the country who've just when snowing and have just collapsed and their heart stops. And then
I try not to be too hyperbolic about it, but there's no question that every year we admit or try to admit a couple of patients through our emergency departments at IU Health who have unfortunately been found down in their driveways shoveling snow. And it's for these folks that I feel very sorry for their families.
Right. So we want that driveway cleared, but not at the expense of doing anything dangerous.
Sure.
And then why should we not eat a big meal before we shovel?
Yeah, so the heart, when we exercise, the heart pumps more blood around our body to our large muscle groups in order to help us to exercise and to get work done. It turns out when we eat a meal, the heart pumps more blood to our intestines in order to digest that food. And it turns out it's a significant increase in cardiac output or blood flow to the intestines. And so if you can imagine eating a sizable meal and then adding the next stressor of going outdoors and exercising vigorously, the heart's trying to send enough blood to the intestines to digest and now to the big muscle groups for exercise. In some of us, that can be just too much. Many of our patients first present to us by reporting heart pain or angina after eating a meal and going for a walk in the evening. There's a real stress to eating food and then exercising, no question about that.
We want to also listen to our body because something could be happening, like you had just mentioned, circling back to that pain in the chest, other symptoms that we're overdoing it and we need to stop.
Right. So the classic symptom that you maybe most know about is that elephant sitting on the chest causing pressure or heaviness. In some cases, that discomfort may radiate up into the neck or the jaw, down an arm or across the back between the shoulder blades. These may all be symptoms of cardiac insufficiency or low blood flow to the heart muscle, especially under stressful conditions. Shortness of breath. I tell people we all get short of breath doing something, but certainly if we're getting short of breath doing physical activity, and especially if we're not used to doing that level of physical activity, slowing down, listening to our body, giving ourselves a chance to get caught up in our breathing may be incredibly important for us. Lastly, if we have a sensation of our heart pounding or racing, or if we start to develop lightheadedness or dizziness, we absolutely have to get someplace safe. And if we don't get better soon, we should summon emergency services perhaps.
Hmm. And hypothermia is always a concern. Could be get too cold out.
Absolutely, we can. And so dressing appropriately for the weather, um, staying warm as we can to try to keep our body warm on the inside. As I mentioned earlier, that when we're outside in the cold and our body is working extra hard to keep our bodies warm while we're working outdoors, it constricts blood vessels at the level of the skin, raises blood pressure, and has other untoward effects down the road. So definitely hypothermia, if we're outdoors for any long periods of time in the freezing cold, that is a significant concern for us as well.
Hmm. Well, Dr. Gill, some really important points you make. Thank you so much for your time.
Of course, thank you very much.